Hey there, welcome to our channel Hecuries_everything. In today's video, we're going over some essential first aid tips that everyone should know. Accidents happen, and knowing what to do in an emergency can save lives. So, let's dive right in. First up, let's talk about CPR, cardiopulmonary resuscitation. If someone stops breathing or their heart stops beating, CPR is a critical life-saving skill. Here's how to perform it. Check for responsiveness. Gently shake the person and shout their name. If there's no response, call 911 immediately. Start chest compressions. Place your hands in the center of the chest, interlock your fingers and press hard and fast, about 100 to 120 compressions per minute. For adults, don't worry about breathing unless you're trained. Just keep the compressions going. Continue CPR until emergency help arrives. If you're trained in rescue breaths, follow that protocol, but remember, chest compressions are the most important part. Next, let's talk about bleeding. If you or someone else is bleeding heavily, it's important to act fast. Step 1. Apply direct pressure to the wound using a clean cloth or bandage. Hold it firmly in place. If bleeding doesn't stop, you can elevate the injury. Just make sure to keep applying pressure. If the bleeding is severe and you can't control it, use a tourniquet above the wound. Tighten it until the bleeding stops, but remember to seek medical help as soon as possible. Burns are common but can be very serious. Let's break it down. For a first-degree burn like a mild sunburn, run cool water over the affected area for at least 10 minutes to soothe the pain and reduce inflammation. For second-degree burns, do not pop any blisters. Instead, cover the burn with a sterile dressing and seek medical attention. Now, for third-degree burns, the damage is severe, and immediate medical care is necessary. Please, don't try to treat these at home. Choking can be life-threatening, but if you know what to do, you can help save someone. If someone is choking and can't breathe, encourage them to cough first. If that doesn't work, you'll need to perform the Heimlich maneuver. Stand behind the person and wrap your arms around their waist. Make a fist with one hand and place it just above their belly button. Then grab your fist with the other hand and give quick inward and upward thrusts until the object is expelled. Always call 911 after performing this, and if you're unsure, don't hesitate to get professional help. Broken bones are painful, but knowing how to treat them properly can help prevent further injury. First, don't try to straighten the bone. Immobilize the injured area by splinting it, using anything available like a board or a rolled-up magazine. The goal is to keep the bone from moving. Get the person to a hospital as soon as possible. And remember, don't try to move the person unless absolutely necessary. Poisoning is more common than you think, especially with household chemicals or medications. If you suspect poisoning, do not try to make the person vomit unless instructed by a medical professional. Instead, call the Poison Control Center or 911 immediately. Have the container or product with you so you can give them the details. And that's a wrap on our essential first aid tips. Whether it's CPR, controlling bleeding, or handling burns, knowing these basics can truly make a difference in an emergency. Remember, it's always better to be prepared than caught off guard. Stay safe, stay prepared. If you found this video helpful, be sure to give it a thumbs up. Subscribe for more life-saving tips and leave any questions you have in the comments below. Stay safe out there.